Good evening, everyone, especially my colleagues at the AHIN General Committee. The topic that I'll be talking about tonight is very close to our heart at AHIN. We formed AHIN in 2011. We all met in Hanoi, and we all agreed that all our countries needed to work better at creating comprehensive national health information systems. So fast forward to 2020, and we've summarized all our lessons into what we call the Mind the Gaps. So Mind the Gaps is basically representing G for governance, A for architecture, P for program management, and S for standards. When we started analyzing the challenges we were facing, in our respective countries, we all agreed that leadership and governance were very important in setting directions and making sure that the priority investments of the countries are spent the right way. And one of the first things that they need to invest on is an architecture or a blueprint. Like the blueprint of a house. Before you actually build a house, you don't go straight to the hardware store and start buying your materials. You don't do that. You sit down first with a certified architect, and together you talk to him about your vision and your aspirations, and the architect will come back to you and give you a blueprint. And using this blueprint, then you will now know how much the house is going to cost, how much material you need to buy from the hardware store, who are the experts that you need to hire to build your house, the carpenters, the electricians, the plumbers. Now, armed with this blueprint, you now get the right people who will manage each part of the components in the blueprint. And this is where you need good program management. And once you have the governance, the decision making, the architecture, the blueprint, the program management, the builders, then you start talking about standards and interoperability, which is very closely related to architecture. And the standards and interoperability are like your building blocks, your standardized building blocks, the same way that you have hollow blocks in your house makes it easy to build the walls for your house and build more houses faster. So don't forget, mind the gaps. If there's only one slide that you will remember for tonight, is that don't forget to mind your gaps, because until we address the needs of governance, architecture, program management, and standards, we will not be able to achieve our dream of having comprehensive national health information systems. So the outline of my talk, I'll focus on the governance part of the Mind the Gaps and share with you our experience at AEN and why we have invested on over the past 9 years on building capacity for IT governance within the network. So sequentially, I will talk about the problems we faced in 2011, and we continue to face these problems of complexity, compliance, and cost. How we are addressing the CCC problem. I'll talk about existing IT governance frameworks. I'll focus on COBIT 5, which is the IT governance framework that we have chosen at AHIN to practice. Very briefly, just give you an update on COBIT 2019, which unfortunately rhymes with COVID 2019. And then matching later on, summarizing how COBIT 5 or COBIT 2019 plays a role in completing the G part of our Mind the Gaps framework. So the challenges of information technology, and this is not just for healthcare, but in many sectors of society as well. It has become a very complex environment where when you have many stakeholders involved, you need to make sure that all of these stakeholders are able to work together cohesively. Then you have the requirements of your field, and you have to comply with the requirements of your field. And then, of course, this is information technology. You have to start paying for some expensive items, and therefore, you hit into the problem of cost. So let's go through them one by one. Next slide, please. Let's go to our field, which is healthcare. And already, even without computers, we already know our environment is very complex. We have so many stakeholders, and many of them with varying and even competing agenda. But they also have dependencies with each other. So, of course, we have the patients at the center of our healthcare system, and then the providers who are giving service to our patients. And these providers could be individual providers like professional doctors, nurses, medical technicians, dentists, or they can be institutional providers like hospitals, clinics, and blood banks and laboratories. And then there are payers, and some of us in Asia have national health insurance agencies. In the Philippines, we call it PhilHealth. In Indonesia, they call it BPJS. But we also have commercial health maintenance organizations, small private health insurance companies who also pay for the services provided by health professionals to their patients. Of course, the famous pharmaceutical companies who are now in a race to develop the COVID-19 vaccine, and government and ministries and regulatory commissions, making sure that everyone is playing fair and everyone is competent as they say they are, and suppliers who make sure that we have the necessary equipment and material that we need to provide good care to our patients, and so much more. I mean, this is just a short list of the different stakeholders in the health sector. And as you can imagine, when you have many stakeholders and call them ingredients, so to speak, it becomes very complex, especially when each stakeholder will have an agenda or an objective that is very different from another. So the payers might want have, the payers will have an agenda of providing quality care at a lowest price possible, but the providers would probably want to deliver quality care at the best price they can get. The pharmaceutical companies would like to get the best price they can get for their medicines. The regulators would want to make sure that no one's that everyone's playing fair, that no one's actually breaching on the privacy of the patients, even as they start managing the data of the patients. So, because you have many stakeholders in the healthcare sector, it becomes a very complex environment. You also have the government and institutions that make sure that the policies are followed and the laws are complied with. So this is a matter of compliance. And one of the things in healthcare IT that we need to comply with are privacy, the privacy of our patients, the confidentiality of the data that our patients give to us, and making sure that this data is secure. So this compliance is very important because if we fail in complying with these regulations, then we are in violation of the law, if that is the law in your country. Like in the Philippines, we have the Data Privacy Act, and it also makes you lose the trust of the various stakeholders if you're unable to comply with these privacy regulations in your country. I think cost is the easiest for us to understand because we don't want to spend any more money than we need to. But in information technology, there are just so many components that are expensive that you need to buy. You need to buy your server, that's a hardware, very expensive. And then you need to buy your laptops and your end user devices. And then they will not work without the software inside. And this software, you need to buy licenses for them or maybe subscribe to them. You need to buy the software, which is called an operating system. And then later on, you have to buy the software that is called a browser. And then you need to subscribe to services like Dropbox. And then you need to install other software. Maybe you have an electronic medical record. All of these need to be paid for. And all of these need to be connected to each other. So you need to buy bandwidth or network connectivity. And you want to buy network that are fast. And you want to buy a network where you don't get a lot of downtime because it's always available. And that's expensive. When you want to get fast internet, that's always available. That's very expensive. And all of these need people behind them that make sure that the hardware are working, the software don't have viruses, and the network is always up and fast. So technical support accompanies all of these. And all of these are very expensive items. And this is really the biggest headache right now of the IT components of companies and of government, because the bill or the cost of these items can go very, very high. And unless you are able to justify to the leaders of government or to the CEOs of the company that these expenses or costs are justifiable, you probably will not be able to get the budget that you need to run your health information technology. So complexity, compliance, and cost. Those are our problems that we face anywhere in Asia. So IT governance, on the other hand, is one way by which the business is aligned with IT. Or you can also read it the other way around, where IT is made to align with the business. And that's what I meant about the cost of information technology need to be pointing back to the needs of the business. Because if you say that you need to invest $1 million on your hardware, software, and network, because that will allow you to earn $5 million or prevent the deaths of so many people or people getting sick, and you lose $10 million in terms of productivity, then that alignment makes the $1 million a cost-effective investment. And that is only made possible if you have IT governance. If you are able to relate your technology investments, your application investments, and your data investments to the business benefits that the company or the ministry wants to achieve. This is also called an enterprise architecture, where you make sure that the business that you need is able to collect the data to run the business. The data that you need to run the business is collected correctly by your application, and that your application is running on the right technology. So that's one way of aligning business with strategy, by starting with the business need, defining the data you need for your business, the applications you need to collect the data, and the technology you need to buy that will run the applications that collect the data that runs the business. If you're able to answer those questions correctly, then you are doing good IT governance, because you are able to connect the technology to the business. So IT governance, there are many IT governance frameworks that you can download. No, you just Google all of these and you can download these IT governance frameworks for free. There is ISO 38500. There is ISO TR 1469, and then there's COBIT 5. Let's go through them one by one. Okay. ISO 38500 is entitled Corporate Governance of Information Technology. This actually started as a British standard, and then the British gave it to ISO, which is the International Standards Organization, and they made it into an ISO standard. It's a very simple IT governance framework, basically saying, before you do anything, you have to first evaluate your environment, the needs of your stakeholders. Once you understand what your stakeholders need, then you come up with a strategy or a set of directions. These directions will become several ICT projects, maybe an ICT project to buy fast internet, that's one project. Another ICT project to buy servers, another ICT project to buy laptops and tablets, another ICT project to buy your electronic medical records. So all of these ICT projects, you buy, you build, you run them, and then once they're running, you pass them on to ICT operations because they're already running 24/7 basis. And because these ICT operations are collecting data on a regular basis, this data can now be fed back to monitor and see whether the original evaluation that you made is being addressed by the technology that you invested on. So the cycle continues. Evaluate, direct, projects, operations generate data, data is used to monitor and fed back to the people evaluating the situation. So if you look at a country, for example, the Minister of Health and the Ministry of Health would be the one doing the evaluation. They will come up with a strategy, maybe like the Universal Health Coverage Law, and they will say, this is our direction. We will use information technology to provide universal health coverage to all Filipinos. Then that will then be broken down into several ICT projects, maybe electronic claims, maybe electronic medical records in all clinics and hospitals. Maybe it will be a Philippine Health Information Exchange. And then all of these projects will then combine and they will be operated on. They will be gathering data and it will now be contributing to the universal health coverage, which was the original idea of the ministry. So very simple framework, ISO 38500. It's like SOAP of the clinical chart. On the other extreme, there is another ISO document called 14639. And this is specifically for healthcare. It's called Health Informatics Capacity-Based E-Health Architecture Roadmap. And as you can see in the graphic, there are a lot of boxes. So if you compare it to ISO 38500, this is more complex and sophisticated than ISO 38500. If you remember, ISO 38500 doesn't have anything specific for healthcare because it's a framework that's used for any sector, agriculture, justice, education, healthcare. But for this 1469, this is there. Again, Google this, you can download the whole document here and you can study this specific IT governance framework. Next slide. And then there's COBIT 5. COBIT 5 is a business framework for the governance and management of enterprise IT. And this is just one of the many artifacts that you will find about COBIT 5. There are 37 boxes here. I'd like you to remember the 37 boxes because later on the number will change when we get to COBIT 2019. So the original meaning of COBIT was control objectives for business and related information technologies. The COBIT version 1 was in the 1990s. It was first used by auditors, and then it progressed to serve several versions until it became COBIT 4. COBIT 4 was mainly the blue area. The blue area was mainly COBIT 4, basically the management of information technology. And then in 2012, ISACA, or the Information Systems Audit and Control Association, which owns the COBIT trademark, added the 5 boxes at the top, and they said those are the governance aspects of enterprise IT. So COBIT 5 is now a combination of governance, which are the top 5 boxes, and management, which are all the boxes in the blue area of enterprise information technology. This is my favorite framework because it's easier for me to understand as the chief information officer of a hospital or as the director of the National Telehealth Center to look at all the important boxes that I need to fill in to make sure that my organization's information technology is governed and managed very well. I'd like to point you to the left upper box most, the leftmost upper box, which is evaluate, direct, and monitor, EDM01, ensure governance framework setting and maintenance. These five boxes at the top are assigned to the board of directors or to the highest accountable entity of the organization. So you might say maybe in a hospital that would be the board of directors, maybe in the University of the Philippines that would be the board of regents, maybe in the situation of COVID 2019, the virus, the pandemic, this would be the IATF. But that left uppermost box is the most important box of COBIT 5 because that box is what I call the light switch box. It is the first box that you turn on. And if you turn on that box, you're basically saying, hey guys, we are going to use all of these 37 boxes and we're starting with EDM01. And EDM01 is saying we will use this framework. Okay, so that's the first and most important box in COBIT 5 because that's the box that will open up all the other boxes. And if we follow the sequence of COBIT 5 governance boxes at the top, after you turn on the framework and tell everyone from the top, the board level up to the rank and file, telling them that we will use this framework, then the next things you need to do is ensure benefits delivery. Make sure that your IT system knows what benefits it should deliver. The next thing is that you should ensure risk optimization, that your IT system is aware and knowledgeable with the risks that the corporation is entering and that they can control it. The fourth one is ensure resource optimization, that the budget given to the IT department is spent correctly. And the last box is ensure stakeholder transparency, meaning everyone from the top to the rank and file will be working in a spirit of transparency so that the work and the data flows across all the different boxes in this framework. So COBIT 5 is a business framework for the governance and management of enterprise IT. So if you look at these three IT governance frameworks, and you can find other IT governance frameworks, by the way. There are more than three, but these are the three that I wanted to present to you tonight. They're also the most popular. If you put them in a line from the most simple to the very complex and sophisticated and health specific, on the left side, from simple, ISO 38500 would be a very simple framework, and you can use it for any sector. On the other side, you have ISO TR 1469, which is very specific to national health systems. In the middle is COBIT 5. And we thought at AHIN that the middle ground of COBIT was, it's not too simple like ISO 38500, and it's not also too complex than ISO 14639. So we selected COBIT as our IT governance framework for adoption to make sure that there's good leadership and governance through the adoption of an IT governance framework like COBIT 5. Of course, we were coming from an analysis that many of our governments were not really well organized in running their IT systems. So we thought that if we promoted COBIT 5 as a way for governments to work on their IT projects, they would have a higher chance of succeeding because they're using a structured framework like COBIT 5. So we selected COBIT-5 because it was not too simple, like 38,500. It was not too complex, like 14,639. We thought it was a good starting point for the ministries of health all around Asia. AHIN, by the way, is composed mainly of officers from the ministries of health. And we thought that if the MOH started on COBIT-5, they can master COBIT-5 and it can help them move later to an ISO TR 1469 because all of the boxes of COBIT-5 are actually in ISO TR 1469. And the clincher as to why AHIN chose COBIT-5 is because there were companies who could offer structured training program for our ministries of health. And if they finish the course and complete the exam, they can actually be certified in COBIT-5. So we had trained more than 98 people on COBIT-5 since 2011, and 28 of them are certified in COBIT-5. So this is something that's doable. Government officers can take this course. It's a 3-day course. They can take the exam, and there are mock exams that you can download and study. And if they pass the exam, they can be certified in COBIT-5. So we think that between ISO 38,500, where it's too simple, and ISO 1469, too complex, and there's no training program, we thought COBIT-5 was the best choice for AHIN because we could get trained on it and we could get certified on it. Now, COBIT-5 was in 2012, and in January, ISACA released COBIT 2019. Unfortunately, that was also the same time that COVID 2019 pandemic came out. So I think there is some confusion sometimes when you hear somebody say COBIT 2019, whether he's referring to COBIT or COVID. But anyway, what's the difference between COBIT-5 and COBIT 2019? Here are some examples of the differences, but if there's only one thing that you will remember tonight, the difference between COBIT-5 and COBIT 2019 are 3 boxes. In COBIT-5, there were 37 boxes. In COBIT 2019, there are 40 boxes. But to be specific, COBIT 2019 focuses on areas and design factors that enable organizations to establish risk management and governance protocols based on their unique requirements. COBIT 2019 aligns with global risk management and security standards, frameworks, and protocols. It gets periodic updates, ensuring that the framework guidelines work effectively with next-generation technologies, rapidly adopted at scale across industry verticals. For example, Internet of Things. So Internet of Things was not thought of in 2012 by COBIT-5, but COBIT 2019 has already this in mind, including artificial intelligence. And then guidelines follow a more prescriptive approach, especially by supporting more tooling and technology available for governance. So COBIT 2019 is more prescriptive. COBIT-5 is less prescriptive. So after we took the course and we got certified, we were still scratching our head and was thinking, so what do I do? Where do I start? No? But in COBIT 2019, they are more prescriptive with the approach. More differences. An enriched open source model that ensures feedback from the global governance community is incorporated into future versions of the framework updates. So in COBIT-5, if you had an idea on how to improve COBIT-5, there was no way it could feed back into COBIT-5. But in COBIT 2019, they created a process by which people adopting COBIT 2019 can submit suggestions, and there will be an expert steering committee to consider your suggestion and later on feed it back into COBIT 2019. And that's a big difference between COBIT-5 and COBIT 2019. You might say COBIT 2019 is more participatory and they are more sensitive to the needs of the people using the framework. Lastly, COBIT 2019 has a strong focus on new technologies. like the system development life cycle, including DevOps and Agile. For those who are from the IT field, you understand these technologies. Off-premise operations, outsourcing, connectivity, and cloud-based systems. So these are recent terminologies, and these are already part of COBIT 2019. And no, they are not in COBIT 5. So if you want to be updated, use COBIT 2019. Now, what's the difference between COBIT 5 and 2019? 3 boxes. So the boxes that are in red are the new ones that were added in COBIT 2019. The other boxes have been there since COBIT 5. Okay. So what are these boxes? They now added a box on managed data. They added a box on managed projects. Actually, in COBIT 5, managed projects was together with managed programs. So in COBIT 5, you will see BAI 01 as managed programs and projects. But here in COBIT 2019, they decided to separate this into those boxes. And then on MEA 04, they added managed assurance. Okay. So COBIT 5, 37 processes. COBIT 2019, 40 boxes. So how do you use COBIT? So I'll give an example of how I adopted COBIT 5 after I got certified in my own backyard in UP Manila. So I was the director of the Technology Transfer and Business Development Office of the University of the Philippines, Manila. And because of my informatics background, the Chancellor also assigned me as the chair of the UP Manila Information Technology Council. So I said, okay, this is complex. University of the Philippines, Manila is the largest and the only national health sciences university in the country. There are 11 colleges. There's one very big hospital called the Philippine General Hospital. A lot of needs for computers, for internet, for cloud services. So I said, this is going to be hard work, but be not afraid. We can start with COBIT 5. So the first step was to tell the Chancellor, Ma'am, I can take the job, but can I adopt COBIT 5 as my IT governance framework? Of course, that was a good opportunity to show the framework to the Chancellor, and I was able to explain to her that, you know, Ma'am, IT is very complex, and she knew that already. IT is very expensive, and she knew that already. And I told her we might hit problems with privacy and confidentiality, and she knew that already. So it was easy to sell to her the 3 C's. And then I told her to manage this complexity, compliance, and cost, I suggest we use this COBIT 5 framework. And then she read each box, and it was very easy to understand. And she said, go ahead. And that is my light switch event when she said, yes, we will use COBIT 5 in UP Manila. Now, right after I got the approval, I started putting names into the boxes, and that's basically making sure that there is a defined responsible person or unit, an accountable person, that's usually the Chancellor. And if you have a chance to also define who will be consulted and informed, you can add that too. Then after I did the RACI matrix, I presented it back to the Chancellor for approval. After I got the approval, and that's the governance part of COBIT 5, I started contacting the people in the RACI, and I told them, okay, the Chancellor authorized me to convene you. She authorized us to use this framework, and now let's start working together in building the IT system of the university, and that's the managed part of COBIT 5. So I started with a blank framework. You already saw this. I showed this to you. This is COBIT 5 because this only has 37 boxes. This is what I used in 2017. And then I just put the responsible people for each of those boxes. So I said, okay, the first 3 boxes in the managed domain, I can take that on. I don't know anyone in charge of managed innovation. I don't know anyone in charge of managed portfolio. So those are blank. Managing the budget is care of the budget department. Managing human resources is the responsibility of the HR department. And then each college or proponent will be building and acquiring their solutions. And then our information management services or IMS will be in charge of delivering, servicing, and supporting whatever the proponents have built. And then in the monitoring, evaluate, and assess on the right side, performance is measured by the administration, compliance to internal policy by internal audit, and compliance to external policy by our compliance department. So I said this would be my RACI matrix. As you can see, there were a lot of blanks, and that's fine. You cannot really fill in the blanks immediately on the first chance, but at least you know what boxes are blank. So I presented this to the leadership, and the chancellor asked me, okay, why do you have blank boxes here? And I told her, Madam, according to the framework, these are very important processes. But according to my assessment, we are not performing, or we don't have responsible people for each of these boxes. And the chancellor said, oh, so that's why our IT system is not working optimally, because we have so many boxes that are unfilled. Many important IT governance processes don't have people working on them. So it's very understandable why our IT system is not working optimally. So again, it was a very easy sell to the chancellor that, you know, we want to grow and mature our capabilities for IT, but look at our IT governance. We have a lot of blank boxes or vacant boxes. I gather the identified people, we met, and then we talked about, okay, of the blank boxes, which are the priority boxes that we need to fill, and who among the UP Manila community do we think can be best recruited to take care of these priority vacant boxes. And that's basically the work of managing information technology. So we started talking, brainstorming, identifying people. I started to talk to these people, explain to them what COBIT 5 is, what we saw, what box we saw was perfect for him or her. And then when they accepted, we would put their name into the COBIT 5 framework, and then I would present it back to the chancellor, and the chancellor would make the appointment papers saying, okay, we are now adding this person to be in charge of this box to the UP Manila IT Council. So we iterated and iterated until we were able to fill in most of the boxes. And that's what I mean about good governance. Good governance is having a framework, meeting regularly, and making sure that there are responsible people taking care of the important boxes of your IT governance framework. So in summary, here are my tips when you want to adopt IT governance. Of course, you need to read the framework. COBIT 5 or COBIT 2019 are freely downloadable on the internet. You can go to isaca.org, isaca.org, and download either COBIT 5 or COBIT 2019. If you have one chance at it, go for COBIT 2019 because it's more updated. Then look at your own organization, number 2, and identify people who are already doing that part of the job. Maybe you already have a CIO, you have an HR department, you have a budget department, so you can quickly fill in some of those blanks. No? Then show it to your leadership and tell them, can I proceed with filling up the boxes and recruiting people for each of those vacant boxes? If they say yes, that's a buy-in. That's good governance. You convene the people that you've identified. You will now be the management team. You look at each of those vacant boxes. You look at the box that were assigned to you and understand what the box is all about. It will be in the downloaded document. It will define the downloaded COBIT 2019 document describes in detail each of those boxes. What are your terms of references and what are your responsibilities? So you can study it for your own group, or you can study it so that you can recruit the right person for the right box. Make sure you update your leadership regularly. So I update the chancellor on a monthly basis, telling her we have filled in 2 more boxes and we are now targeting 3 more boxes. I'm eyeing Dr. this for that. I'm eyeing Mr. this for that and Mrs. this for that. Then you go back and do the cycle again until you're able to fill in your IT governance framework completely. My last statement is you actually have 2 choices with your IT department in your organization. You can tell them, just go ahead and do what you're doing, and you probably would have some successful projects, you would have some failed projects, and you would still be scratching your head and asking yourself, why is it so expensive? Why are we spending so much on hardware, software, and network, but we're not getting a lot from these investments? If you catch yourself asking those questions, you need IT governance. Because if you had IT governance, you won't be asking yourself that question. Because the IT governance framework systematically brings you to understand what are the business requirements at the top coming from the board, and how do you translate all of those business requirements into the management boxes at the bottom until you get to delivering the IT solutions, generating data that feeds back to the board of directors, giving them something to tell them that they are actually improving the business situation of the organization. If you do not have IT governance, that closing of the loop will not happen. And if it does not happen, they will tell you your IT budget is too expensive because I do not feel the benefit of our IT investments. So ladies and gentlemen, if you want your expensive IT budget to be appreciated, I strongly encourage you to adopt IT governance. You can use ISO 38500 or you can use ISO TR 14639, but I recommend COBIT 5 or COBIT 2019 because there's a training program for it. You can get trained on it. You can get certified on it. Many doctors got certified on it, so you can do it as well. And once you're trained and certified, then you can start implementing the framework. Do you need training to implement the framework? No, you can study it by yourself. I studied it for 1 year until I finally decided to take the examination. So yes, you can study it on your own. And I think with IT governance, you are in better shape compared to not having any framework at all. So with that, thank you very much, and I'll be happy to answer your questions.
Thank you, Dr. Alvin. We would like to Dr. Min Sambat to share his experience.
Thank you, Suren, for your introduction for the reactor. And thank you, Dr. Alvin, for the great presentation about the COVID-5 and COVID 2019. And for me, I think the IT government and the COVID-5 or COVID-19 is good for the IT framework. In Cambodia, we still have some concern because the Ministry of Health, we don't have the IT department from the central to the sub-national level. We don't have the IT department. So this the hard one that to manage the IT system in the healthcare. So mostly the IT grow up in private sectors and that. So, but we have use ICT in healthcare for the long term since 2010, and when we have a high information system in web application, also we have a patient medical record in the Ministry of Health. So this and good to hear that the Philippines can adopt the COVID-5 for the IT government. So that's a great point. So I have some question to Dr. Alvin. Is the IT government or COVID-5 is great, but we need the way how to adapt in a country level, like how we can advocate or country understand about this is the hard point one, like for the Cambodia, we don't have the IT capacity in the Ministry of Health. Even the leadership, if the leadership not understand about the COVID or IT government, it hard for the advocates or adapt for the country. And it any approach that we can advocate or like a WHO or other international organization like ITU can adapt or acknowledge this framework, and then they can encourage the country to apply it, because like most country they have follow the WHO that have the office country, and then they have the guidance on the IT or health information system. So what do you think, Dr. Alvin, so that how we
Thank
can
you.
approach this?
Thank you, Dr. Sambat. In the WHO ITU, National E-Health Strategy Toolkit, they already defined leadership and governance as important, but they did not recommend any framework. So that's basically what AHIN did. We went further when we looked at governance frameworks, and we found COBIT-5. In terms of adopting COBIT-5, I will not advise you go straight to the ministry and tell them to adopt COBIT-5. What I would do is go first to your organization and you adopt COBIT-5 yourself. Learn about how it works, succeed, fail, succeed, fail, succeed, succeed, succeed. And then when you're confident, you can now go to the ministry and tell them, why don't you use COBIT-5? And you will now be a credible person because you yourself ate your own dog food. You were able to practice it yourself. So that's my advice. Start at your own backyard first. Do it there, learn from it, master it, and then that's the time you approach the ministry and tell them, let's adopt an IT governance framework, and I can help because I've implemented it myself. Thank you, Dr. Sambat.
Thank you. That's all for me.
Thank you, Dr. Sambat and Dr. Alvin. Next, we go with Dr. Yadana Au. Hi, Dr. Yadana.
First of all, I would like to appreciate and thanks to the reader of this section, and also hopefully MOHS, Ministry of Health in Myanmar, can apply that the COBIT to meet the stakeholder needs as the core principle of the COBIT to fill the gaps of the IT governments that Dr. Alvin mentioned in the presentation. And also Myanmar, as far as I know, on the long way to strengthen the IT governance, I have a very limited to share knowledge and experience of the 2D to bit COVID-5 or 19 framework in Ministry of Health and Sports Myanmar. Otherwise, there in Myanmar, there is a training course at the non-governmental business organization for COVID-5 SSR certification course from the health from the IT enterprise. But that the two days COVID-5 training course, as the cost is the $1,200. That was the expensive to join the course, and I would like to make a special request to give the training for the government officials who are working in the digital health initiatives, especially e-health unit of the MOHS. And also we can upgrade our IT skill for better implementing the IT governance at the IT governance with the aims to deliver the development solution and the professionals around the CLMV country and train the government official to stay the updated health IT industry, best results oriented practices and skill sets. And also thanks again for the Dr. Alvin for sharing his experience and very nice presentation. And my question is there any free online course for the COVID-5 training?
There are online sites I've seen where you can do self-study. You can just Google self-study tutorial COVID-5 in YouTube, and you can learn. They're actually very good. But I think the only time you will be confident is when you start using the framework. So for myself, I did not take the training program. I only sat in together with the first group of 30 people. I just listened together with them. So I could not take the exam. So, but after I sat in with them, I applied it. And then after 1 year, I got confident, and then I paid for the examination myself. I did not take the training anymore. I just went straight to the examination. So the training is $300. That's certified training with a free exam, or you can just take the examination. The examination is 300. I chose the latter. My recommendation: go to YouTube, COBIT 5 tutorial or self-study, and then apply it in your department or in your ministry or in your university. And then as you start reading each of those boxes, you will understand what it's all about. You will become confident. You don't need a certificate. If you're already happy with applying COVID-5, then everything is finished. You don't need to take the certificate anymore. I took the certificate because I wanted to go to the next level. So the first exam, you get certified in COVID-5 Foundation. And then there's a next level called COVID-5 Implementation. I wanted to take that course also, but I needed to have COVID-5 Foundation first. So I took the COVID-5 Foundation, paid for it on my own, and then for my COVID-5 implementation, WHO was the one who paid for it, together with 17 other people who passed the COVID-5 Foundation in the first group. So I encourage you, self-study first, and then apply it.
Thank
Thank you,
you.
Doctor.
Thank
Thank
you,
you.
Dr. Yadana. Next, let's hear from Dr. Tepatan Sosavan. Hi, Dr. Tep.
Good evening. Thank you very much. I would like to thank you very much, Dr. Alvin, for your good presentation. And based on your presentation, the IT government framework is really important and interesting to develop in Laos also, because the main objectives are to increase the efficiency of the government operation. It means that bring the government service to the people by using electronics as the communication to provide the service and to get the high efficiency, convenience, safety, and transparency and saving. So now I would like to say the situation in Laos. Laos government is preparing to build e-government. The system will cover e-office, e-share or email, etc. And right now is the construction of the infrastructure and building capacity for human resource. As for the COVID-5 or COVID-19 is also interesting, particularly as Lao PDR or MOS is the thinking of the IT government as the part of the planning for conversion workshop.
Yes.
Perhaps our starting point should be something simple, such as the COVID-5, I think.
Yes.
Because the COVID-19 may be more complicated. Then the build on to something more complex over time. And particularly in the mapping, like responsible, accountable, consult, and inform, which could be applied to any initiative.
Yes.
But however, I think that you mentioned in the last sentence, budget, the human resource in Laos are still the main issue. I would like to learn from you more about the document that related to this framework. Yeah.
Yes.
Thank you, Dr.
I will
Alvin.
email you the document so that you will see. The document will describe each of those boxes. It will describe what needs to be done, by each of those boxes. And even between now and February, when we have the convergence workshop there in Vientiane, we can already start filling in your RACI, doctor, so that by the time we
Okay.
get to Vientiane in February, we already have some people identified in some of those boxes. So it will help in our preparation for your convergence workshop. We'll help you. Don't
Okay,
worry.
good.
Thank you, Dr. Tep. Last but not least, let's hear from Dr. Pampandat.
Hello. And okay. Thank you, Dr. Anvils and everybody. Yes, it's a very interesting topics in Vietnam, and we concerned about the international certification several years ago. Even I also joined joined the class with to study the COVID-5, Prince 2, and PMP. Yeah, several years. But it's difficult to implement COVID-5 in the government office. I think it's easy to implement COVID-5 in the private sector better than the public sector. In the Vietnam, the Ministry of the Information Technology developed a framework we call a national enterprise architect framework, and issue to every ministry in Vietnam, and Minister of Health also develop a health enterprise architects framework, follows the national enterprise framework. The framework, the Vietnam Enterprise Architect Framework, and develop follows the TOGAF, but there are some revision with Vietnam situation. But I think COVID-5 also is very good for governance, because we understand that we can the technology we can study from various sources, but the governance methodology is very important for implement the successful national program. But I think if transfer the COVID-5 into the Vietnam, we have to transform it and integrate it with the digital transformation program, and how to, if we can develop a governance framework based on the COVID-5 and apply for the digital health digital program, health digital transformation program. I think it's better, because I think it's difficult to open mind of the leader to study COVID-5. I think it's very difficult, and but we need the framework that apply for the digital health transformation, and thank you, Dr. Alvin, is my sharing.
Thank you, Mr. Dat. So remember, COVID-5, free download, easy to study, difficult to master. It starts today. So I invite you to study the material. It will really be helpful.
We have a national IT project funded by World Bank about 10 years ago. 10 years ago, and they also support us for training COVID-5, COVID, PMP, Prince 2, E2.
Yes. Yes.
10 years ago. But now I think no one in this group can remember it. Because I not
Start,
applied for the government sector.
start using and applying. That's the best way. Thank you.
Yes,
Thank you,
yes,
Mr.
yes.
Take care. Azurin?
Okay. Thank you to all our speakers and reactors for sharing their expertise with AHIN committee tonight. Due to time constraint, we will end our webinar session now. And if any participant have any question, you may email us at secretariat@ahin.net. Before that, we would like to invite you to join our 7th AHIN General Meeting, which will be held on January 2021, every Thursday from 7 p.m. to 9 p.m. Manila time. For more information, please visit AHIN website. Thank you, everyone. Good night.